morning, everyone. My name is Mara Walsh, and I am one of the founding partners at PharmaVOICE. I would like to welcome you all to the PharmaVOICE 100 Celebration Ignite, the virtual event. From all of us here at PharmaVOICE, it is an honor to have you with us. Thank you for joining us today. Before I introduce my friend and colleague and our event chair, I'd like to take some time to invite you to connect and engage in today's event. Participate in our networking breaks, to be active in our sessions and discussions with the Q&A and with the polling system that we have in place. We ask that you rate the sessions and provide feedback. If you have any questions or concerns, please reach out to our event partner, Sherry Gelfand, or myself, as we are here to help you throughout the day. I wanted to also take the time to thank our amazing panelists and completely stellar cast of people who are accomplished in the pharmaceutical industry. In addition to our panelists, we want to recognize our sponsors for today's event. Please take a moment and visit them by clicking on the exhibitor icon on the menu bar. Now I'd like to review the virtual platform with you quickly. It's a really great platform and encourages a lot of interactivity. It's extremely user-friendly, so take some time to explore. We invite you to interact, participate, ask questions, request meetings, attend the networking breaks, fill out the polls, and rate every session and every speaker. Just check out all the buttons on the menu bar and connect with everyone who's here today. As part of our efforts to make this experience as engaging as possible, we will be doing an Amazon gift card giveaway based on your overall engagement as attendees today. Earn points by posting on the event feed, asking questions, or voting on polls during the sessions, setting up meetings, and visiting our sponsors' booths in the exhibit hall. Your point position can always be seen on the event homepage or on the leaderboard center at the top right-hand corner of the platform. We will announce the attendees who come in first, second, and third place at the event happy hour, which is at the end of today's event. Thank you all for your time. And now I would like to start our first panel and introduce our chairperson and moderator for this event. Many of you know her, but in case you don't, her name is Taryn Grome. She is the editor and co-founding partner at PharmaVOICE. Now I'll give the floor to Taryn. Taryn, take it away.
Thank you so much, Mara. I am a co-founder and the editor-in-chief of PharmaVOICE, and I also want to thank you all for spending your valuable time with us today. And a sincere thank you to our sponsors who made this day possible. And another big thank you to our event partner, Momentum Events, whose expert guidance and professional production have helped make this event come to life. And of course, a shout out to the entire PharmaVOICE team. Way to go. We are so excited to have you join us for our second virtual PharmaVOICE 100 celebration. We wish we could all be together again in person, but we hope we have designed a program that allows as much interaction as our screens will allow. We are so thrilled to have so many of our PharmaVOICE 100s with us today on our panels and in our audience, which is a testament to this community that we launched in 2005. We never envisioned the impact this award would have on so many deserving inspirational leaders from across the industry. We like to say, once a PharmaVOICE 100, always a PharmaVOICE 100. Before we get into this morning's first of 8 sessions, we asked our 2021 PharmaVOICE 100 honorees, in keeping with this year's theme, to briefly share how they are igniting change, blazing new trails, and sparking innovation. Let's hear from them.
Igniting change by empowering all patients to have control over their reproductive lives, because access to sexual and reproductive health care should be a right, not a privilege.
We're sponsoring a number of grassroots programs in the Bay Area supporting STEM education for diverse students from elementary school to graduate school, including PhD students and medical students. In fact, tonight I'm packing to take a group of 4 BMS STEM interns from our summer program on their first ever backpacking trip. Excited about that.
Just as tired of hearing about patient centricity as you are. It's not even the right term. At Clin One, we prefer patient empowerment. We spark change by giving patients the power to control their clinical trial experience with remote technologies to participate and share with family and loved ones. And change is needed.
Innovation at Lambda Therapeutics by setting fearless and audacious goals and giving people the confidence to achieve them.
Sparking innovation by fusing diverse talent.
I'm igniting change by redefining the lives of people living with obesity.
I'm igniting change by going back to basics and listening, because you can't change the world if you don't really listen. I spend a lot of time listening to client requirements as well as their challenges, because each client has very different priorities, capabilities, and capacity. Taking time to understand the scenario helps build trust and is a great foundation for igniting change.
I'm igniting change for my clients in life sciences by driving from strategy to execution so they achieve sustainable digital transformation impact. I'm also inspiring my teams to push themselves and constantly raise the bar.
I'm igniting change by empowering everyone to contribute to the greatest extent of their talents.
How can you blaze a new trail? Do something successfully that nobody's done before. Well, first, look beyond the edge. Do not necessarily stay on a defined path. And second, work with the best people to test whether you're right or wrong and leverage collective intelligence.
I am proud to be blazing new trails in diversity and rare disease by helping launch the Rare Disease Diversity Coalition and building inclusion into all aspects of the rare disease journey, from research and clinical trials to innovations in care and equitable access to treatment.
I'm blazing new trails in the physician engagement world for the pharmaceutical industry.
Wow. Spark, ignite, and blaze. I'm so inspired, and it is my privilege to introduce this morning's panel, whose full bios can be viewed by clicking on their headshots in the speaker section below. We have a great lineup to get us started today. Sophia Begg, Executive VP, PowerXL, the 2021 PharmaVOICE 100, who you heard on the video, is sparking innovation by fusing diverse talent. 2020 PharmaVOICE 100, Dr. Deepa Desai, founder and CEO of D-Cube Consultancy, who is blazing new trails by challenging the status quo. And Sir Vatsan, Chief Digital Officer, R&DS Technology Solutions at IQVIA, a PharmaVOICE 100 2021 and 2010 honoree, who is blazing new trails to drive clinical trial transformation. And Amy Turnquist, Principal North Highland, a 2020 PharmaVOICE 100, who is igniting change by redefining what is possible. This roundtable is intended to be highly interactive, so we encourage our PharmaVOICE 100 community, who more than 600 of you are right now registered, of engaged attendees to, well, engage. Send us your questions. This is your chance to ask some of the industry's most inspirational leaders what's on your mind. Hello, my friends. How are you all? I hope everybody's great. Thank you so much for joining us. We have our first question. And it is, what do you believe is the single most important leadership skill or trait, and why? Sophia, because I do everything in alphabetical order, let's start with you.
Yeah, good morning, Tara, and thank you for that. I think you kick off the session with an incredibly difficult question, and the reason is leadership by its very nature is very multidimensional. As leaders, we need to develop an arsenal of skills to help us on our day-to-day sort of leadership journey. And I think in today's session, I think throughout the day, you will hear that again and again. But if you ask me to choose one, that is the most important for me, that's authenticity. You probably wonder why authenticity. Honestly, I believe that's the magic ingredients, the secret sauce, if you want to say it, that actually accentuates, strengthens and fuels all your other leadership traits, whether it's engaging with people, maintaining flexibility, establishing emotional sort of stability. It doesn't matter what you talk about. For me, it allows you to bring the best of who you are. I will also say in today's ever-evolving, changing world, For me, authenticity is an incredibly important element. People throughout the world, in work, outside work, are looking for leaders that they can believe in, that they actually put people first, ethics first. I would say have a purpose beyond the financial gains, which leadership is often associated with. So for me, authenticity is a universal trait, one that translates across borders, across cultures, across organizations at every level, across generations, actually, funnily enough, and something that is incredibly important to bring to the table. I think in summary for me, when you're authentic, that trait allows you to engage people well, it allows you to build trust, and it really motivates people into action to deliver formidable results.
Well said, my friend. And authenticity, you're right, it builds trust. And that is what we need today. Deepa, I'm going to turn to you now.
Thank you, Darren. I feel that, what Sophia said is right. Authenticity is the basis of a leader. But when, whatever the last year has taught us, or in the last 18 months, we have seen that for me, I believe that being agile is also one of the very important traits that a leader can have. Because, in the past, we've been so busy designing strategies for the next 2 years, 5 years, and 10 years. And here comes the pandemic, and it changes all our bases and all our thinking. So I also feel that in real life, a leader needs to be very agile, be flexible, and also needs to have a risk-taking appetite. And I think being agile is that, you have your plans drawn up, but it also helps you to respond to the changing environment, the changing situation, and the changing demands. And we all, as being in healthcare, I think this is of priority to be agile. It also helps you to the way you react with your team members, because when the situations and the environment change, the responses that you expect from your team members might also change. So a leader needs to quickly go back to their drawing plan, look at the team members, look at the strengths that are available now, and what is the requirement in the environment now, and be flexible to take the risk. So for me, I believe that agileness is one of the important traits.
I think you hit the nail right on the head. If the last 18 months have proven anything, if we're not able to pivot, we're in big trouble. So well said. Sir Watson, I will turn to you now, sir. You're on mute.
Sorry. Hi. As Sophia and Deepa said, it was a good start with authenticity and agile. My key part is truly leadership is about how do you help others succeed. And the reason I put that is, whether it's making customers succeed, making your employees succeed, making your team succeed, it really puts that in the forefront of what a leader should be doing. And I always say a leader is one who has only two things to do. One is remove obstacles in front of his team, and two, to be the cheerleader behind the team. Because if you could do that in the right way, you're going to be motivating the teams to be agile, the teams to be authentic, teams to be supportive, and to driving it. The critical component, at least post the pandemic, I've heard and believe in, is leaders have to also be more empathetic. Empathy is a very big characteristic which is needed in this changing world of how do you be supportive to your team, supportive to your customers, supportive to the changing needs of where things are. It's a skill set which one needs to acquire and learn, but it is one which is innate in all of us. How do we listen, and how do we be able to connect, and then how do we be able to then help people succeed and transform. I think as one starts to do that, the role of that leader of making others succeed is to build a environment where people can have a growth mindset. As Deepa said, there's lots of agility needed. As Sophia said, you need to be very authentic, but really what you need is to create an environment for everybody to have a growth mindset, that things are changing, but you have to grow and grow with what needs to be done. So again, critical things, support you or help others succeed, whether it's a customer, employee, do it in a very empathetic manner. And as you do that, you can make success happen for yourself, but more importantly for your teams.
Wonderful, Srivatsan. I love that. Servant leadership, removing those obstacles, be a cheerleader. And you touched on something that was really important, is empathy. 2 years ago, we weren't talking about empathy as a leadership skill. It was considered a soft skill, if anything at all. And now we're hearing so many CEOs and senior leaders talk about how important it is to keep that front of mind when they're leading their teams. Amy, talk to us about your top leadership skills.
Yes, so at the risk of being redundant, I could come up with something totally out of the box, but realistically, I think I need to validate everything that everyone just said. So when we think of authenticity and agility and then empathy, I agree with Srivatsan in that, my sense of leadership, our job is really to help others achieve and be their best, which requires that personalized approach to really understand what their experience is. So taking almost an employee experience or customer experience lens to that relationship to help them. You mentioned authenticity and creating the psychological safety for them to bring their full selves to work and provide them with the tools or the resources that they need to be able to deliver on that work. So I would say, and again, reiterate everything that everyone just said, I feel like we're all reading from the same playbook, which is why I'm honored to be on this panel today. But I would say if I had to order them, I would start with empathy, because I think that drives everything else that we've been discussing about how do you create authentic experiences and give people the psychological safety to think in an agile way at work.
Amy, it's not easy to go at the end of one of the rapid fires, but you did an awesome job. And I agree with you. I'll just reiterate, I think empathy is one of those key skills that we all need to think about in terms of leading forward. So because we won't put you last, again, we'll start with you on this next question. So one of the questions is, what is the go-to piece of leadership advice you share with others?
Yes, so there's so many things there as well that I've learned from others, but I find that one topic that keeps coming up often in some of the mentoring and coaching that I do with other leaders, particularly women, is around imposter syndrome or insecurities. I think one of the things that I learned throughout my own career was that as I was looking up to people that I admired and people who inspired me, I always believed that everybody else had everything figured out. So I think, one of those big pieces of advice as a leader is to recognize that many of us we're all learning as we go. And if we bring that authenticity, that spirit of authenticity that Sophia mentioned, and even empathy and a little bit of patience for ourselves, I believe that can help us do our best work. So I think generally the feedback and the conversations I'm often having is when we find ourselves in those situations where we experience self-doubt, you remind yourself that those people, those men and women that you're looking to, that you aspire to become, they have had those same moments of self-doubt. So acknowledge what you're going through, but just do it anyway, because that's how we learn and that's how we advance throughout our careers.
And along the way, be kind to ourselves, right? Because we're not going to do it perfectly all the time. And sometimes, especially when we're our harshest critics. So be kind to ourselves. Excellent, Amy. Thank you. Adipa, I'll turn to you. What is the best piece of advice that you provide out to your folks?
So I think that in the last 2 decades of experience, two things have really stuck to me. Okay, one is that do not postpone happiness. So happiness is now. So I would just tell everyone, and it kind of, sounds or aligns with what Amy was saying, that, you need to be having self-doubt moments, but you need to see that what makes you happy, what are you comfortable with, be kind, and do first the kindness and the happiness starts with yourself. And the other big thing that has really always inspired me is that if plan A fails, try plan B. If B fails, try C, because we have 26 letters in the alphabet, so don't give up. So I think that this is, and it also sticks with what I try to practice, that, if something is not working right, don't get stuck up there. I would say that, there are so many different ways of doing the same thing and achieving your goal. So don't get stuck to your plans, but be flexible.
It goes right back to your agility. And I love that there are 26 letters in the alphabet for a reason. It gives us 26 different ways to attack a problem. Sophia, I'll turn to you next.
Yeah, I'm going to go back to, as leaders, we have only so many levers to succeed. And the one that I constantly go back to is about the people. within our business. If you get the people side right, everything else falls into place, including financial results. Dare I say, it's an outcome. And my advice to people often is focus on the people around you, focus on your team, get the right people in the right places. You're only as good as the team around you, so invest in them. A lot of what I heard this morning so far is all about emotional intelligence. So often in the past, we focused on EQ. I think IQ is what gets the outcomes and the results. And whether it's empathy, agility, or everything that we discussed so far. So get the right people in the right places. Your decisions will be only as good as the people around you and what they share with you. And, I think that is a very simple formula for many things for me.
Again, excellent insights into what it means to be a servant leader. Sir Watson, we'll let you round us out for this question.
No, again, some very great points around imposter syndrome, as well as being authentic, and as Deepa said, to make sure that we take care of ourselves. I think going back to what Sophia said, it's definitely the people, and how do you get the right people in play. But for me, to get the right people in play, you have to get the right mindset. And I want to say that the people and the teams you're selecting have to have what I call the growth mindset, the need that things are going to change, things have to be evolving, and therefore not everything is a status quo. And I think that's a secret ingredient. A lot of times we hire to competency versus hiring to what that expectations are, or what one can do and achieve. And so for me, really, if there's one go-to piece of leadership, how do you create that culture for growth mindset? How do you encourage people to have a growth mindset? And that's going back to what Amy said. How do you give a platform where people are feeling safe to have that growth mindset, challenge the norm, really to be questioning, why should we be doing it this way? It's also about encouraging people to think differently. I love what Deepa said. You have plan A, B, C, D. So what is your plan A, B, C, D for that? Why is only the plan A going to be working, and what are the trade-offs? And I think that's a critical skill. I'm an engineer by background in life sciences, and the only thing I tell people is that when you go to engineering or any school, you learn how to learn. And therefore, in our lives, the journey is all about learning and continuing to grow. And so if you could create that environment, infrastructure for growth, as Sophia said appropriately, people will grow, and then organizations will grow financially, customer-wise, and all of that. But it's just creating that infrastructure for growth, and that starts with a mindset.
Absolutely. And creating that mindset within your organizations is not easy. And it takes a lot of hands-on dedication to doing it. So we have another question in a few minutes that we have left. The pandemic, because we can't have a panel without talking about the pandemic, the pandemic experience has accelerated innovation in many ways, from virtual ways of working to automation. What lessons do you take away that we can apply after life returns to normal? And we're not defining what that normal is. There's no way to know right now, right? So who would like to tackle this one?
Darren, I mean, this is a passionate topic for me. I think the clinical trial infrastructure is in a new normal. We can't go back, let the genie back in the box. We're working remotely. We're having patient engagement and much more. I think what the pandemic has done is really changed the infrastructure from a sponsor perspective to patient. And I love the word patient empowerment and others, which some of your panelists and PharmaVOICE said. And so when you start to frame it, that now your patients are going to be anywhere, at home, at near-time clinics. They're not going to come to the hospital. How do you engage them? How do you keep them active? How do you then support them? And we're all in a new S-curve of normal. And I think the pandemic has been a positive influence in our industry in a way that it has challenged the status quo. It has asked us all to have that growth mindset. What can we do differently? And the conversations are pervasive. It's just not with sponsors. It's not just with technology people. It's not just with CROs. It's not just with it's with regulators, and it's the the industry at large. What is amazing is we gave the whole world a lesson on clinical trials over the last 6 months. I mean, everybody knows now what a double-blinded clinical trial is, and what's the effect, and what's an adverse event, and why SAEs are important, and we couldn't have had a better mass education as possible. And so as we go forward, I think the new norm is about personal and patient engagement. It is about remote and engagement, and we're going to be having a combination of digitization and people and process all coming together. And so it's an exciting time. But with that exciting time, we're also on a change curve, Taran. Not everybody is on the new S curve, and there are people who are in the old. And so I think the next 18, 24 months, we're going to have to be change agents. We have to support the change because you got to bring everybody along. And so I'd say that there's a lot to learn, but a lot to influence as we look forward to in the next 24 months.
Srivastava, that was great. Absolutely. And, being change agents and change management, that's the hardest thing because people don't like to change. So Sophia, I saw your hand raised there.
Yeah, I just want to add to what Srivastava said. Honestly, I think more people are on that S curve than ever before. That's number one.
That's a good thing.
But I don't know about you guys. It's amazing for me how often I've heard over the years what can't be done. It can't be done. It has to be done this way. And I think what the pandemic has done for us is to challenge our thinking, to challenge the status quo, as was just said, and actually more about how can it be done. And the number of people that have pivoted about how can it be done. If there's one thing I hope we take with us to the new norm is the ability to think things can be done if you put your mind to it.
A lot more can be done with can than can't. Absolutely.
Exactly right.
I'll turn to you, Deepa.
Yeah, a quick one here, because I feel that there's a huge silver lining with this pandemic because, all this while the leaders have been, for any strategy, they would do a pilot study. And now is the time where you've got 100% in this remote, 100% of your employees or your teams in remote situation. So now you have all the data set that you require. So now you can look at a lot of opportunities and possibilities. So I do believe that it was a strong pilot where you have a large sample size.
And Amy, I'll give you the last word in the last minute we have.
Great, thank you. Yeah, as I was thinking about this, Taran, I think the theme of PharmaVOICE last year was about this idea of asking what if, right? So prescient in being able to ask that question, because what if we could expose our workforce to bring in the best talent beyond, a 50-mile radius of where our offices are by a hybrid workforce? Those weren't questions we were asking before, right? What if we could bring a drug to market within 12 months? We would never have asked that question, but what if we could do it again? Right, so I would reiterate what everyone just said and just think back to where we left things last year, right, with those conversation starters around what's possible, and now it's given us the opportunity to think more creatively about that.
So well said, absolutely. As we look to round out today, we are going to be asking those questions. What can we do? Where do we go from here? And what's possible? It's a growth mindset. It's the S curve. It's about being authentic. It's about being agile. It's about all those leadership traits that you all discussed today. I can't thank you enough, Sophia, Deepa, Srivastava, and Amy. What a great way to kick off our day. And I want to thank our audience as well for all their great questions. And I want to say a thanks to our sponsors, Synovian Pharmaceuticals, Calcium, Encedo, Ogilvy Health, Parexel, Syneos Health, Umotive, Health Union, Medtrix Healthcare, Alnylam Pharmaceuticals, eMIDS, Levlane, and North Highland. So thank you all so very much. And to join our Sparks of Leadership panel, I ask our audience to go to the agenda and click the join session button. We'll see you there shortly. Thank you so much, and I hope you all will be able to stay around for the remainder of the day. And please join us for our Ignite Happy Hour at the end, where we're going to meet our PharmaVOICE 100s in a little bit more detail and find out some fun facts about you all. So thank you all so very much for kicking us off today. What a great way to start.
Thank you.
Thank you. Have a nice day.